legal to have this vaccination, then vaccination reduces hospitalization mortality and cost-effective preventive strategy and enhances quality of life and independence. I think this actually is brief that how this geriatric vaccination is important.
ये मूव नहीं कर रहा भाई स्लाइड.
So can we change the slide, please?
ये भी पॉज हो गया. हाँ. नहीं तो ये स्लाइड पॉज हो जाएंगे तो टाइम इंडेफिनिट हो जाएगा.
I think this is one slide back, I think. Yeah. We're talking about the hesitancy date.
Yes. Yeah. Alright. नहीं है ना?
So one point is that Dr. Wadhwa has actually asked me to tell about that hesitancy in geriatric age group, right?
That we'll do next. First, the vaccination schedule.
So this is geriatric guideline. This is the Indian Geriatric Society, which has actually laid the guidelines for viral vaccination. And we all know that influenza every 60 years, 1 dose annually. And that definitely the high priority of flu prevention is there. Then 65 years or sometimes at 60 and patients, less than 60 also when the patient having asthma or COPD, we can do it a little late, prior also. The pneumococcal, that is PCV, followed by PPSV23 after 1 year. It prevents pneumonia, sepsis, and meningitis. Then herpes zoster is now available in our country since 2023. It's named by Shingrix. It is recommended for age more than 50 years of age. 2 doses, 1 dose, and second dose is 2 to 6 months apart. It prevents shingles, and most important is post-herpetic neuralgia. Then Tdap, as already discussed by the panelists, once after 18 years, but in elderly also, if not been vaccinated, Tdap booster, followed by every 10 years you can go TDs, which is available. COVID-19, the guidelines which comes as per the government advisory. Then Hep B is already talked about. If not been vaccinated, it should be. And especially for patients who are diabetic and who are healthcare workers. Hepatitis A as per the requirement. And this is all, this is MMR, because we are seeing a lot of this measles cases in elderly population and mumps also as well. Yes. So if they're not vaccinated, they should be vaccinated.
I think, hepatitis A is actually for this age group, most of them are actually naturally already immune, so we can skip that.
Yeah.
What I wanted to ask was, which is what we see in our day-to-day practice, the senior citizens, especially super senior citizens, they don't want to take vaccine. They say, no, give it to our child, grandchild, but we don't want to take. How do you handle that in your clinic?
So I think hesitancy is definitely, sometimes the elderly patient comes to us like they become child and, right. So why me, right? It is too late actually for me to vaccinate it. So it is a healthcare worker responsibility or moral duty actually, because we do see a lot of complications in this group because of immunosenescence, right? So there are common barriers that they should feel that there are a lot of severe side effects. In fact, there is hesitancy in COVID vaccine essay, because most of the patients, sometimes this elderly group, they don't take COVID vaccine because of the fear of, side effects. So definitely we have to provide clear empathetic counseling to the patient that how it can prevent the complications. Then believe that vaccines are unnecessary at older age. I think this is very biggest myth that is running the society. So definitely we have to educate at risk and benefits of vaccine at any age per se. Then cognitive issues or dependency, because we have to involve the caregivers who are coming with the elderly people, that if you vaccinate the patient, definitely they become more independent in life. And there is that lack of recommendations by doctors. Actually, we're not talking about the vaccination in this age group. But now post-COVID, I think we are starting. In fact, I have also started my vaccination center at my clinic, and there are a lot of posters are there in the clinic so that the people come and they see, and definitely they would go for the vaccination. And definitely we have to train physicians to be proactive in vaccination of the elderly population. Thank you.
So can pediatricians give adult vaccinations?
Dr. When I can answer this question?
The chairperson will answer
that. Yeah.
Okay, so since you are dealing with adults and geriatrics, any one of the adult physicians here can answer this. What about healthcare professionals? What all we should, just in 2 minutes, tell us, which are important for all healthcare professionals? Anybody? Dr. Gaurav can say if you want to.
So thanks the team for inviting me. For healthcare professionals, actually, we don't really need to have a very separate list, because if we look at the adult list of vaccinations, if we look at all of this we should take, yes, there are certain professional risks that we have. So we need to be making sure that we are not only vaccinated with hepatitis B, but we have done our titers. It is very important to make sure that we are not 5 or 10% who are non-responders. So please make sure that you get 3 doses and then you do a titers. If the titers are above 10, you never need to be vaccinated again unless you are immunocompromised. So I think that would be very important. We need to protect our patients. So vaccinations like MMR, chickenpox, we should be up to date if we have not had the disease. And honestly, with all the things going on outside food. We should also make sure that we are up to date with our hepatitis A, typhoid vaccine, and 10 years, every 10 years Tdap. And please take flu vaccine every year. I don't know if, can I have a raise of hands, how many take flu vaccine every year? Yeah, it's better than last time, but it's still not even close to 30%. So I wish we take it because we will infect patients. We ourselves feel कि हम लोगों को तो protection है भगवान ने दी हुई है because we are doctors. But honestly speaking, आप patients को भी infect कर सकते हो. So please make sure that you take them.
What about TDAP for doctors? TDAP.
Tdap, I said, yeah,
Tdap,
take one
yeah.
dose and then you can, I would probably say take the Tdap every 10 years, but the recommendation is take one Tdap and then take TD every.
TD, because the immunity doesn't last long.
True.
Plus what happens is that they may not suffer from pertussis, but they can still transmit. So it becomes a little dicey situation. So TD is good enough. And all these studies, they say that people taking care of newborns, so people, the healthcare professionals who are working in nurseries like Dr. Ankur, they should definitely take TDAP, but all of us otherwise TD will do for us. Okay, so that's what we discussed. In summary, I'll just tell you that there are adults which are more likely, 100 times more likely to get diseases as compared to children. 100 times more VPDs happen. The immunity wanes over time. The adults were never vaccinated in children, quite a few of them. Newer vaccines are now available which were not there. And advancing age renders them to more diseases which actually children may not suffer as much. And when they did a study, what are the barriers and challenges in adult immunization? The most common which came up was the lack of healthcare provider knowledge. So that's why physicians, like he said, have started now. This is the most important thing, that the healthcare provider should be ready to give the vaccine to the person, the adult who's coming to the clinic. The rest of all the other things, missed opportunities, lack of understanding, all that can be managed. So then, okay, Dr. Gaurav, you can continue this. What are travel vaccines? Are there any special vaccines required if you're traveling in our country, Africa, Middle East, Europe? I've just made 4 subheadings.
So, yeah, so there is mandatory and there is recommended. As far as India is concerned, there is nothing which is mandatory for India except if you are coming from a yellow fever endemic country or if you are coming from a country which is listed in India as a polio endemic country. So if that is not the case, you don't require anything from a mandatory perspective. But I'm sure most of us have, or many of us have read the articles about foreigners who got rabies after coming to India, playing with some stray dogs, stray cats. So it is very important that people who are coming to India, if we know them and if they come to us immediately after landing here, we do suggest that please make sure that you are up to date with rabies. Food and water obviously is a challenge, so hepatitis and typhoid. Again, ideally these vaccines should be taken 2 to 4 weeks before they come to us. But if they're here for a month and if we give them the vaccine today, at least 1 hafte ke baad, 10 din ke baad, they'll get some protection. So these are the vaccines, and of course the routine vaccine, we have discussed them so many times, so I'm going to not talk much about them.
Even I think cholera can be thought of, although it's not available still,
Yes.
but we can think.
In certain areas.
And the problem with typhoid vaccine is if they come from abroad and they
Yes.
take the typhoid vaccine there, which will be only a polysaccharide vaccine.
Yes.
Unfortunately, they do not have conjugate vaccine, so as soon as they come here or take the vaccine, go back and come back again.
Yes, and JE is another one. If you are staying for a long period in even rural areas and even a lot of urban areas now, then that should be considered, especially if they're traveling in monsoons.
And then Africa, I think meningococcal
Yeah, so
yellow fever.
Yeah, so yellow fever is mandatory in certain countries in Africa and also South America. Polio, depending on again specific areas. Routine immunization, I've just highlighted the 2 which are different from us, which is meningococcal and malaria prophylaxis, which we should suggest in case they're staying for a long period of time in Africa.
Okay, then what about Middle East?
Probably it's commercial reasons, they were not getting enough number of patients. So nowadays, practically what we do is, I give the live vaccine for adults because even a single dose is good enough and the adult and pediatric dose is the same.
And time is coming,
Sorry. Yeah.
our way. So what about?
Sir, वैसे भी आप time 9:50 तक है, हमारा तो 9:40 हुआ, अभी 10 मिनट है.
अभी और लोग भी हैं.
मिलाना मुश्किल है because वो pre-filled होते हैं, but अलग-अलग दो दे सकते हैं. नहीं, I think they come in
Pre-filled
pre-filled
means
syringe.
there is a needle attached to it.
There is
no?
a
How
needle
you mix
attached to
them?
it. हाँ. So there is one brand in which has a 1 ml inactivated also. I think Habisure by some Bharat or something.
Have sure.
Habisure, yeah. So they
that
have
has
1
an
ml.
adult dose.
That's inactivated. But live is good enough, single dose for adults is good. Okay.
If you have 720 vial, then of course you can mix
Yeah, you
together.
can. And again, I've just highlighted the one for Middle East. If you're going for Hajj and Umrah, then you need a quadrivalent meningococcal, which is, and of course polio certificate, same there. And other vaccines are similar, including cholera, as sir pointed out, not available in our country, but it should be recommended.
And if you're traveling,
So
suppose
Europe and USA, I think a lot of us do. So the good news is none is mandatory for these places, and they have low risk as compared to India for almost all the diseases. So yeah, you don't need to worry. But yes, think about flu if you're going during flu season. You don't want to fall ill while you're traveling. And I put the last one, tick-borne encephalitis, because I actually got a couple of people who came. We don't have this vaccine in India, but if you are traveling to Central Europe and hiking, then that is something. So beyond that, it's all the same. So just make
I
sure.
think, yes. I
Just
think-
make sure that if you are traveling to a unique country, to a different place, 4 to 6 weeks before, if you are here, meet Dr. Arun Vadva. If you are in Chandigarh, you can come and meet me as well. They will tell you anything special which you need to take, and make sure that your cards are up to date, especially if you are traveling to yellow fever country. Make sure that you have WHO international certificate of vaccination. Thank you.
Good. So I think I will pose this question to the audience. You know, the family comes to you today, although you're here, maybe if you go back to the clinic, they come and say that Monday we are leaving for South Africa. We haven't taken the yellow fever shot. What will you do? Audience will answer this, not panelist. So what? They're going to South Africa. When they come back, the passport will be checked. Where did you go?